Assalamu alaikum. My name is Rasool and today the topic for my presentation for pharmacy practice final year is estradiol cypionate. So let's start with the presentation. First of all, a very brief introduction of my topic, that estradiol cypionate is sold in with the brand name of Depo Estradiol. Depo Estradiol is basically an IM injection and it is not available in the form of oral dosage form, that is capsule or tablet. So it is basically an estrogen medication that is used in hormone replacement therapy for the transgender women and for postmenopausal women who have low estrogen levels in their body, and it is also used in hormonal birth control for cis women. And so we could say that it is an steroid and it is a female sex hormone and used in hormone replacement therapy for all the women who are facing decreased amount of estrogen in their body. Now let's study its mechanism of action and all the further details. Now looking at the mechanism of action, we got to know that this drug, the Depo Estradiol, or we could say the estradiol cypionate, it basically acts or it binds to the estrogen receptors, and then it causes the gene transcription. As a result, it causes the increased amount of hepatic synthesis of the sex hormone in the body and decreases the follicle stimulating hormone from the anterior pituitary. And as a result, the amount or the concentration of estrogen increases in our body, and the postmenopausal symptoms, or we could say the vasomotor symptoms in a postmenopausal woman, are decreased. Alright. After that, let's look at the indication. The main indication for the Depo Estradiol, that is the IM injection, it is indicated in the treatment of the moderate to severe vasomotor symptoms. Now, what are the vasomotor symptoms and vasomotor symptoms, which are basically related to hypoestrogenism? Now, the vasomotor symptoms which are related to the hypoestrogenism are the night sweats, the hot flashes and flushes. Other than that, the vulvovaginal atrophy, that is called as the vaginal dryness, and the most common symptom is the dyspareunia. All these symptoms are together called as the vasomotor symptoms, and these are faced by all the postmenopausal women who have been facing through the hypoestrogenism, means the level of estrogen is less in their body because of the hypogonadism. So for all those women, IM depot injection is indicated to maintain the level of estrogen in their body and to decrease all these vasomotor symptoms in their body. Now I have added a very simple picture in my presentation, and this picture is basically showing the mechanism of action of our drug, that is the Depo Estradiol, that how it is acting on our body, that how it is acting on the gonadotropin hormone and decreasing the amount of the follicle stimulating hormone from the anterior pituitary and increasing the amount of the estrogen in the body to reduce all the symptoms. Then let's come towards the uses of the Depo Estradiol. Depo Estradiol, as we know that it is an depot injection that is used IM for all the menopausal women. So it is used in all those women who are between the age of 45 to 55 and who have dropped in the level of the estrogens because of the changes of the life. As we know that menopause comes with a lot of changes in the body. So all those women who have changes in their body after the menopause, they take this medication. Other than that, all the women who have been who have operated for an operation that is the and that causes them natural menopause or any surgical menopause, so in all those women this medication is indicated. Other than that, this medication is also indicated in all those women who are using who have basically, we could say, severe itching, burning and dryness around their vagina. To treat all these kind of symptoms, estradiol cypionate injection is indicated. And for all those women too whose ovary cannot make enough estrogen. Now there are also certain women who have ovaries who are not menopaused, but their ovaries cannot make enough estrogen for their body. So for all those women who have reduced amount of estrogen in their body, they are indicated to take Depo Estradiol injection. Alright, so after the uses, let's come towards the side effects. There are very side effects of these drugs, as it is an hormone, so it comes with a lot of side effects like migraine and having difficulty to orgasm, the vaginal pain, discomfort, swelling ankles or feet. We could see that the most important side effect among it is the depression. The female starts to feel depression. Alright, and other than that, most of the females, they feel they get vomiting or nausea, they have loss of appetite, they feel the bloating, and they have very decreased sex drive because of this medication. And it also affects the stem cells of our body, and as a result the person may face leukopenia, thrombocytopenia, because it causes the bone marrow depression, as it is an steroid. So steroids usually cause the bone marrow depression, and because of that the person may face fetal aplastic anemia too. After that, let's come towards the contraindications. Now this drug is contraindicated in pregnancy basically, alright, because in pregnancy we have always many of the drugs which are that have toxic effect or whatever, they are contraindicated in pregnancy. And it is an hormone, so and estrogen is always not required in pregnancy, because in pregnancy progesterone levels are high, not estrogen levels are high. So if we will give estrogen to the person or to the female, she may get abort or her baby may die. It is possible. So that is why it is contraindicated in pregnancy and in all those patients who have stroke or heart attack, because it increases the heart rate na. So that is why we have to contraindicate in all those patients who have heart attack or who have faced heart attack. Other than that, it is contraindicated in cancers like the breast and the uterus cancers, as it is an steroid and it affects the hormone, so it is not indicated in all those patients who have been treated with cancers or who are cancer patients. Other than that, there are many patients who are allergic to Depo Estradiol, so they will also not take, otherwise they may get any hypersensitivity reaction. And persons who have unusual vaginal bleeding, they should also not use estrogen medication. After contraindication, the drug interactions, there are a few drug interactions of this medication, that it may interact with the St. John's wort. Other than that, phenobarbital, blood thinners, and ritonavir, that is an antiviral, carbamazepines and rifampin or any other antibiotics, these are all contraindicated or they have drug interactions with these medications, so choose wisely. After that, let's look at the rationale. The Depo Estradiol shot or the Depo Estradiol injection, it is used in the as we know that the main rationale for this medication is it is used in the treatment of the vasomotor symptoms that is related to the hypoestrogenism, and that is basically due to hypogonadism. And if we look at the dosing along with the rationale, so we get to know that the usual dose, it ranges from 1 to 5 milligram injection every 3 to 4 weeks, and for treatment of female hypoestrogenism due to the hypogonadism, 1.5 to 2 milligram injection at monthly intervals. It means that the time interval or the peaks are very late. Alright. Then the irrational use is basically that use in which it is not indicated, or we could say that maybe the dosage is not correct. Alright, so for that it should be used in intramuscular route, via intramuscular route. Other than that, no other route is required, or no other route will be effective, we could say. And the dose range is 1.5 to 2 milligram, and more than 2 milligram may cause cancer. And we also have to see the intervals too. We cannot use this injection every day or every weekly. We have to use it every monthly. So we also have to look at the intervals, the dosage and the indication. After the irrational use, let's come towards a case study that is related to the use of the estradiol cypionate. Now the case study says that GH is a 52-year-old female and she has a history of irregular periods. 6 weeks ago, she developed an Escherichia coli urinary tract infection and was treated with oral, that is per oral sulfamethoxazole and trimethoprim BID for 3 days for 7 days. She is experiencing urine incontinence, vaginal dryness, difficulty while urinating, itching, burning, irritation, discharge and dyspareunia because of the hypoestrogenism, but she is not taking any medication for it. What is the possible treatment for? Okay, the case is very simple. If we look at the case, that there is a female and she has all the vasomotor symptoms and she has hypoestrogenism because if we look at the age, she is 52 years old female. So 52 years old female, she is now in her menopause age, so she is experiencing all those vasomotor symptoms, and other than that she has her UTI. She is also diagnosed with an UTI infection, that is because of E. coli, and for that she is taking the Septran, that is the sulfamethoxazole and trimethoprim. Alright, this is very correct. We will not touch or interfere with that urinary tract infection. We have to see that what medication we will give for the hypoestrogenism. Now for subjective, the patient history, as we know that she has been diagnosed with an E. coli UTI, and other than that she is facing irregular periods and all the dryness of vagina and itching, burning, urine incontinence, all that. And if we look at the medication, so she is taking sulfamethoxazole and trimethoprim BID for 7 days per oral. For objective, what I saw that her age is 52 years and her gender is female. Let's come towards the assessment. Look, as she told us that she is facing itching, burning and dryness and all the vasomotor symptoms and the vaginal atrophy. So first of all, I'll recommend her certain tests that will include a blood test to check the levels of the follicle stimulating hormones and the estrogen, because if the levels of estrogen are normal, first of all the levels of estrogen will not be normal because she is facing hypoestrogenism. So for that I know that she will definitely come up with less quantity or less concentration of estrogen in her body, but we also have to check the follicle stimulating hormone levels in her body to continue our therapy or to give her medication. And other than that, I'll also recommend her to do TSH, that is thyroid stimulating hormone test or the thyroid function test, so that we can see that what are her hormones in our body and is her thyroid also in the correct concentrations or not, or is working correctly or not. Alright, so after her test, if her estrogen levels will be less, and as she is a menopausal woman and facing all the vasomotor symptoms, so my plan will be I'll recommend her 1.5 to 2 milligram injection at monthly intervals IM. Alright, so this is my presentation, and in the end I have also added the reference of the books from where I have taken the information. And thank you so much. Allah Hafiz.